and welcome to everyone in the House and Senate joint hearing to receive the legislative presentation of the American Legion. I'm honored to be here with Chairman Isaacson and Senator Tester and Ranking Member Rowe and all members of the House and Senate Committees on Veterans Affairs. First, I'd like to thank Commander Rystad for being here today and welcome every Legionnaire here today and those who couldn't join us in person but are watching from home. Commander, I want to begin by recognizing the tireless advocates who work every day on behalf of the American Legion. We rely on the American Legion in our districts and states back home, and here in Washington, D.C. to be the voice for the millions of veterans you represent throughout the country. I'd also like to specifically recognize members from my own home state of California. Are you in the House? All right, all right. California, American Legion Boys State, right here. Thank you. And by the way, I'd just add, now more than ever, we benefit from the civics lessons that are taught through American Legion Boys State and Girls State, and I know that the tremendous volunteer effort through the auxiliary and your membership, what it takes to stage those Boys State and Girls State events throughout the country, and America certainly benefits from having that civics education and leadership development that you provide. For 100 years, and I realize that last year was your 100th year anniversary since your founding, and very poignant founding since the World War I and such a consequential war for the world and our country. Members of your organization have been on the front lines as a strong voice on Capitol Hill, ensuring Congress fulfills its promise to veterans. We look to you to guide our work and to hold us accountable to the veterans and their families. You make sure the work we undertake is done in the best interest of veterans. And with your help, we have seen a lot of successes over the years, and we will need your continued input as we move through the 116th Congress. Reading through your testimony, I want to say that your concerns are my concerns. This afternoon, the House Committee on Veterans Affairs will have Secretary Wilkie testifying on the state of the VA and what needs to be done to achieve our vision for VA through the year 2030. Our VA 2030 plan is simple. It's a future look at what we envision as the ideal VA, a system worth saving for all veterans, no matter the generation or conflict in which they served. That starts with getting implementation of the Mission Act right so veterans can access care at VA hospitals and clinics and with community providers. I hold with your similar concerns regarding hiring and retention. We must continue to find constructive ways to bring the best and brightest to VA once they are there, and once they are there, we need to keep them. Keeping pace with the fastest growing population of veterans is crucial. Women veterans need to know that VA is for them. We agree with your assessment that no veteran should have to choose between caring for a child and receiving health care. And we are proud to report that the House passed the Veterans Access to Child Care Act just a few weeks ago so that veterans who are parents to young children can see their VA provider without having to worry about finding and affording child care. And thank you, Julie Brownlee, for your bill. Thank you. And I want just as much acknowledgement for our Republican colleagues because this bill passed with 400 votes in the House, and I don't want to pass over the hard work of my ranking member, Phil Rowe. Thank you, Phil, for your work on that bill as well. And I know and trust that Senator Isaacson will burst this through the Senate in no time, in 0 seconds flat. Right, Senator? Zero. Zero. We know how fast they work over there in the Senate. And we will continue to work with you to advance the benefits to all Vietnam veterans serving on land and sea, especially those exposed to Agent Orange. We will double our efforts to end homelessness and strive to find and care for every veteran who may be contemplating suicide. And while I just touch on a few of the issue areas that are important to you and your membership, know that I'm committed to helping advance your priorities in the coming year. I look forward to hearing your testimony today, and thank you again for your tireless advocacy of the veteran community. And with that, I now recognize Chairman Isaacson for his opening statement.
Well, thank you very much, Chairman Takano, and congratulations on rising to chair of the House Committee on Veterans Affairs. And to Phil Rowe, I want to tell you what a great pleasure and privilege it was for me to work with you for 4 years as your chairmanship in the House, and appreciate the things you did to support us. We've been a great team for the VA for the last 4 years. John Tester, who's my ranking member in the Senate, is my partner. We're not adversaries. We're not in different political parties. We're Americans, just like our soldiers are on the battlefield. We recognize heroism not by party. We particularly appreciate all you do. And I have to tell you, I want to thank you, Mr. Rystad, Commander, and the others for the Four Corners fireside chat that we celebrated 2 days ago with you at the Washington Hilton. That was a great way for us to be able to talk to you in a setting that's much better than standing up at a podium and speaking, which ends up being a lecture. And that's not any fun for anybody, but to sit there in a nice, overly soft chair, I might add, and for an hour and stay awake and be cogent, that's a good challenge for old men anytime, so we're glad to do it. I want to congratulate you on your 100th anniversary. I mean, that is a great milestone. My wife and I celebrated our 50th wedding anniversary last year. I know what big anniversaries mean. I hope I make to 100 on that, but if I don't, I'm glad y'all made it to 100 in terms of the American Legion. I appreciate very much your organization and what you mean to all of us. We have a big agenda this year, and our agenda in the Senate, from my standpoint, and I think it's shared by all, is to see to it that all the things we did the last 3 or 4 years, the new GI bill, the accountability bill, the appeals bill, the whistleblower act, all the things that we did, now it's time to see to it they're in place and working. You don't want to go pile a whole lot of new stuff on somebody until they swallowed what you've just given them, and we just gave them a lot to swallow. My last conversation before I came in here was with Mr. Wilkie, who is going to see you this afternoon, hobbling in on his bad Achilles heel, so don't give him too much trouble. He's in agony and pain. Any of you ever had an Achilles problem know that's not comfortable, but he's a great leader at the VA, and we appreciate him very much. And I've told him we will share the same commitment to all of you. We'll do everything we can to make the promises that we've made reality, make them reality as fast as possible. We will make mistakes, but there are a couple mistakes we won't make. One, we're not going to make the mistake of privatizing the VA, I can guarantee you that. We're not going to do that. But we're going to see that we empower the private sector to be a force multiplier for the VA so people can have timely appointments. The best of care that's available in the United States of America goes to our veterans, and we'll not stop until we get that done for everybody. It's important that we make sure the VA, all the things we've bragged about for 2 years, become a reality that you expect every day when you go to the VA. We appreciate the people who volunteered and fought for this country, risked their life for this country, and stand for this country to support it today. When you come to Washington to advocate for the American Legion, there are a lot of other things you could do. But you're not just advocating for yourself. You're advocating for all those who went before you in the military and in the service of the country. So thank you for what you've done. Thank you for being here today. And thank you for being a part of the greatest country on the face of this earth, the United States of America. Mr. Chairman, I yield back.
Thank you. Thank you, Chairman Isaacson. And I now yield to the ranking member of the Senate Veterans Affairs Committee, Senator Tester from Montana.
Thank you, Chairman Takano, and thank you for being here. Commander Rystad, let's see, I saw you on Monday, and I saw you on Tuesday. Hell, I see you every day. I'm more than I got fingers to count with. So it's great. It's great to have you here today. Look, I have enjoyed working with you and your legislative staff and great Legionnaires like Mike Shepard, Cliff Larson, Bill White in Montana. You guys have been great, and I want to thank you for your leadership Commander Reistad, as the American Legion is here before us, because we've accomplished a lot, but we still have a lot to do. As I've said before, as I said Monday, and I think I said it again yesterday, Congress needs to take its cues from you. You know better than anyone how VA is performing across this country. You know what improvements should be made on behalf of veterans and their families. Your members are beneficiaries of the VA health care and utilize VA programs every day. Listening to veterans shouldn't be a courtesy from the VA, it should be mandatory. Commander, we need to hear your views on how gender disparities at the VA, what can be done to provide more equitable treatment for our women veterans, on whether the VA is doing enough to address the unacceptable rate of veteran suicides, on implementation of the Harry Colmery Act, a law which builds upon 75 years of the GI Bill and American Legion history. But most importantly, today, we need to know whether you believe the implementation of the VA Mission Act, the largest overhaul of veterans health care in a generation, is being carried out as Congress intended, and more importantly, as veterans deserve. There is very real concern from the veterans community and Congress that the recently proposed access standards will steer a disproportionate amount of veterans and taxpayer dollars to the private sector. And despite language in the Mission Act, it is clear that the VA does not intend on holding community providers to the same standards as VA providers. We need to make sure that doesn't happen. So we'll end up sending more veterans into the communities for lower quality care while being unable to ensure they get it done in a timely manner. These are all challenges, but challenges that we can fix. To top it off, nobody can tell us how many veterans will ultimately be impacted by these access standards or how much it will cost. All we know is that community care is more expensive than VA care and that billions have been paid to third-party administrators that should have gone directly to improving the lives of veterans across this country. VA refers to concerns about the hollowing out of the VA care as false and predictable, but everyone in this room, I believe, knows that they're real. Veterans deserve more than that. They deserve the truth, and they deserve a system that will work, a system that is built and improved with the input from the American Legion and others. Commander Reistad, it is great to have you here today. We need to keep meeting like this, quite frankly. And I want to welcome you, and I want to welcome everybody you represent on behalf of the American Legion, their families, and the veterans you serve. Thank you.
I'd now like to thank you, Ranking Member Tester. And now I'd like to recognize my colleague on the House side, the Ranking Member, Dr. Phil Rowe. You're now recognized for your opening statement.
Thank you, Mr. Chairman, and I also want to associate my comments with Senator Isaacson. In the last 2 years, we were able to accomplish a lot of great things for our veterans, and it wouldn't have happened without the leadership up here. And I said this yesterday, one of the reasons I don't think this is going to be as long a meeting as some of them are is that Tim Walz, who you all know, who's now governor of Minnesota, used to bring either one or two 20-ounce Mountain Dews. So this is not a 20-ounce Mountain Dew hearing, I hope. Commander Reistad, to you and all of your members of the American Legion and the American Legion Auxiliary and sons of the American Legion who are with us today, and I want to thank the auxiliary members, and I've said this yesterday. You know, I was deployed, and when we get deployed, we forget about the responsibilities we leave with the family. We have a mission. We go accomplish that mission, but there's another mission, too, and that's to keep your family together, to look after your family and all the things at home. So thank you, auxiliary members, for being our wingman and our backup. Thank you very much for that. It's an honor for me to be here today, and if there are any Legionnaires, I think there are, my fellow Tennesseans, would you please stand up and be recognized or hold your hand up, either one, if you're here? Yep, there they are in the back. Thank you, guys. I know from personal experience the commitment to country and to service that the American Legion members exemplify in communities, including mine, across this great nation. I also know from personal experience that the leadership that the American Legion's top-notch executive and legislative team exemplify right here in our nation's capital. Last Congress saw a record number of transformative pieces of legislation signed into law to reform the Department of Veterans Affairs in both large and small ways, and that would not have been possible without the dedication and partnership and support of the American Legion. And one of the things that I did as I began to work through this was that you all, and we didn't always agree, as you well know, but we came in and worked these differences out, and it was a model for how legislation could go. You have a different viewpoint than I might have. We got in a room and worked out those differences, and I think we can all be proud of what we did. I look forward to continuing the collaboration with you, Commander Rystad, to ensure that the legislation we worked so hard to see signed into law is implemented as we intended and serves to further our common mission to uphold President Lincoln's promise to care for those who've borne the battle. Last week, the Veterans Appeals and Improvement and Modernization Act, or AMA, went live. The AMA completely revamped the way disability claims and appeals are processed at the VA, and critically gives the veterans greater choice and control over how their appeal is handled at the VA. Let me give you just a personal story. About a month ago, I was in Nashville, went to the RO and to the VA hospital there. On the way out the door, I met I think an 8-year Marine reservist who served in the 70s. Didn't go to Vietnam, but he served in the 70s. He had tried for 7 years to get his claim done. He had decided to go for the ramp program. In 90 days, he had what took 7 years. I mean, this man was grinning from ear to ear. He could be a poster child, and I hope it works that way for many other veterans. I was really pleased when he just bumped into him sort of accidentally there at the VA. As you know, another thing very near and dear to my heart, and I know to yours as well, is a fight for our Blue Water Navy veterans. I've carried that fight for almost 10 years. I want to get that done, get that off, and treat these veterans the same as every other veteran that served in Vietnam was. So I would appreciate your help with that. And I know Senator Isaac and Senator Tester, they were great partners with this and worked very hard to get that done. And I feel confident that, I know Chairman Takano is ready to get it done also. We both already dropped legislation for that. Another top priority of mine is, as others have said, is effective and ongoing oversight of the VA Mission Act. The Mission Act is a wide-ranging piece of legislation, and when it was enacted, it impacted virtually every facet of VA healthcare system and increased access to high-quality care in VA medical facilities in the community and via telehealth. It will result in the VA healthcare system that is stronger, that are able to care for veterans and their caregivers both today and for generations to come, and this will not privatize the VA. That said, a law as transformative as the Mission Act doesn't come with an instruction manual, and I anticipate there will be some stumbling blocks and struggles in the weeks and months ahead that will once again require our effort to overcome. I remain committed to that process and to keeping my door open to the American Legion throughout the process. I will also continue to hold Secretary Wilkie's feet to the fire with regard to the implementation of the Harry W. Comey Veterans Education Assistance Act of 2017 until I'm confident that every veteran has received the benefits of which they're entitled, and the implementation of the Department of Veterans Affairs Accountability and Whistleblower Protection Act of 2017 until I'm confident that the VA is appropriately adjudicating allegations of misconduct or poor performance and treating whistleblowers with respect and seriousness that they are entitled. Last, but certainly not least, I'm committed to closely overseeing the electronic health record modernization. Greater information technology support generally and improved coordination between VA and DoD particularly are a key to VA's future on every front. Also, I know that the Chairman is very much committed to this, is to work on our homeless veterans and suicide. I know that's very near and dear to the Legions. I know that's one of your top priorities. I commend Chairman Takano for retaining the Technology and Modernization Subcommittee that we established last Congress, and I look forward to significant work this Congress to address VA's technology needs. Commander Rystad, we should all be extremely proud of the work that we've accomplished together in the last 2 years. However, as you can see, we still have a lot of work ahead of us. And I'm glad that you and your fellow Legionnaires are steadfast partners in that work, and thank you once again for being with us here in Washington this morning, and all the Legionnaires that are here. I look forward to receiving your testimony, and I yield back my time.
Thank you, Ranking Member Rowe. Let me just say a few words about the commander before I accord him the time to give his opening statement. Brett P. Rystad was elected National Commander of the American Legion on August 30th, 2018 in Minneapolis during the organization's 100th National Convention. and I was very honored to actually be able to address that convention myself in Minneapolis. He has been a member of the nation's largest veterans organization since 1981. He is former law enforcement. He retired as a lieutenant with the Fairfax County Police Department after 26 years of service. My goodness, congratulations on that. And began a second career as a law enforcement services coordinator for the Regional Organized Crime Information Center of the Regional Information Sharing Systems Program, a congressionally funded law enforcement investigative assistance program. Rystad's, the commander's American Legion membership eligibility is through his honorable Vietnam War-era service from 1974 to 1978 as an active duty U.S. Army infantryman, where he served with the Presidential Salute Battery of the 3rd U.S. Infantry Regiment, the Old Guard, at historic Fort Myer, Virginia. He participated in the inaugural ceremony for President Carter and other high-profile ceremonies, and he has since been honored as a distinguished member of the regiment. Commander, we're very honored to have you here today, and I now give you time to present your opening statement. Oh, excuse me, okay. I was on, Commander, let me just hold off here. I made that introduction because I was not anticipating that the gentleman from Louisiana would not be here to introduce you himself. So I want to make sure that I accord him time. And Mr. Clay Higgins, the gentleman from Louisiana, you're recognized to introduce the commander.
Mr. Chairman, Mr. Ranking Member, thank you for this gathering today. The commander I sit next to is a great and humble servant of his nation, and by extension, all of our fellow man, I thank him. And Mr. Chairman, as a former member of the House Veterans Affairs Committee, it's my honor to join you this morning, and my great privilege to introduce our guest of honor, the National Commander of the American Legion, Mr. Brett P. Rystad. I've had the opportunity to get to know Mr. Rystad over the past few years, and as a fellow Army soldier and law enforcement officer, I was pleased to hear of his election to the position of National Commander at the American Legion's 100th Annual Convention last August. Mr. Rystad is a patriot American of the highest order. As a young man, he served his country with honor as an infantryman in our nation, was engaged in the Vietnam War. A true servant of the people, Mr. Rystad stayed in uniform after his Army service ended, becoming a police officer in Fairfax County, Virginia, and retiring at the rank of lieutenant after 26 years of service. Mr. Rystad's service and dedication to our men and women in uniform is evident in his exceptional leadership at the American Legion. Having joined the organization in 1981, he rose through the ranks, serving at every level of the American Legion, becoming commander of Post 270 in McLean, Virginia, and eventually department commander for the Commonwealth of Virginia in 2005, where membership reached an all-time high. He recently completed his second term as gubernatorial appointee to the Commonwealth of Virginia's Joint Leadership Council of Veteran Service Organizations, where he helped coordinate the input of 23 VSOs in crafting legislation on behalf of our veterans. The American Legion is among the nation's largest wartime veteran service organization, recognized as the nation's largest wartime veteran service organization. With 12,806 posts in communities from sea to shining sea, members advocate patriotism and honor and promote national security and continued devotion to all those who served. As the organization celebrates its centennial and storied past, Mr. Rystad has emphasized the theme of celebrating our legacy and remains committed to carrying out his duties on behalf of our veterans, men and women in uniform, and their families. I'm proud of the job he has done, excited to see what he will continue to do, and proud to call him a friend.
Commander, you are now recognized to to present your opening statement.
Thank you, Mr. Chairman. It's great to see all of you here. Before I begin my opening statement, I would first like to introduce a few critical members of the American Legion family. I ask the following people to please stand if able and be recognized. The American Legion national officers who are serving with me this year. Our distinguished American Legion past national commanders. Kathy Dungan, President of the nation's largest patriotic women's organization, the American Legion Auxiliary. Past national presidents of the American Legion Auxiliary. Greg Gibbs, National Commander of the Sons of the American Legion. Past national commanders of the Sons of the American Legion. And for the rest of us, we are Team 100! Thank you. Good morning, Chairman Takano, Chairman Isaacson, ranking members Tester and Rowe, members of the House and Senate Committees on Veterans Affairs, and distinguished others among us. Thank you for the opportunity to discuss the American Legion's legislative priorities with you. I also would like to thank Congressman Higgins, a former member of this committee, for his kind introduction, for his military and law enforcement service, and for being a member of the American Legion. During the last Congress, these two committees played a pivotal role in the passage of the most significant veterans health care legislation in many years, the VA Mission Act. It was aptly titled. While there's still much work to be done regarding implementation, let me tell you about our mission. Mission is a word that we take very seriously, something that has been forged into us since our first day of military training. It is an inner fortitude that tells us that no matter what it takes, we will accomplish the task at hand. It is synonymous with being a veteran. We have seen this clearly demonstrated by the men and women of the U.S. Coast Guard, who, despite its stoppage of pay, continued to deploy more than 2,000 members a day at sea and ashore. Yet they were treated differently than their DoD counterparts. Pay uncertainty is difficult for everyone impacted, but especially those who, by contract, are required to continue working and risking their lives in an occupation that provides, at best, modest pay. The American Legion did not fall short of our mission in January when, in just a 2-week period, we provided more than $1 million of financial assistance to Coast Guard families with young children. It is times like this, Mr. Chairman, when it's not about what we did, but rather what we do. This is where we hope Congress and the administration can live up to its constitutionally mandated mission to support our military. Whether it's through the Pay Our Coast Guard Act or advanced appropriations for Coast Guard payroll, we should all abide by the Semper Paratus motto, always prepared. Another special population that takes its mission seriously is our nation's law enforcement officers. Last year, 150 of these heroes died in the line of duty, protecting and serving our communities. It's not surprising that many military veterans continue to serve their country through careers in law enforcement. Service before self, even to the point of sacrificing one's life if necessary, is just one of the many commonalities shared between military members and first responders. From an epidemic of opioids to criminal gang activity and domestic terrorism, the life of a law enforcement officer is fraught with danger. We ask Congress to always consider how legislation impacts members of these special communities. Further, There are many constituencies that deserve our support, but none more so than Gold Star families. I'm proud to announce that the American Legion has recently created a full-time staff position dedicated to advocating for the needs of these families whose loss is immeasurable. Again, Mr. Chairman, it's not about what we did, but rather what we do. President Lincoln referred to this loss as, quote, "so costly a sacrifice upon the altar of freedom," unquote. And perhaps nothing is more important than preventing the number of Gold Star families from growing. That said, not all of America's war casualties come from enemy bullets. In 2017, the VA reported that the suicide rate among 18 to 24-year-old male Iraq or Afghanistan U.S. war veterans had risen fivefold. For 18 to 29-year-old female veterans, the suicide rate doubled. We also know that PTSD, TBI, and feelings of a loss of purpose or belonging are frequently found among those who attempt such tragic and permanent endings. These feelings and conditions are either preventable or treatable. It must be the mission of every Legionnaire, every veteran, every employee of the DoD and VA, and I might add, every member of Congress, to stop such national tragedies. Simply put, access to timely treatment and quality health care saves lives. In 2017, the American Legion commissioned a report that confirmed what we already suspected. VA performs as well or better than its private sector counterparts in areas such as patient safety, patient satisfaction, care coordination, and innovative medical practices. But we do recognize that geography and specialty care sometimes means the VA is not always the best option for patients. We support the administration's recent announcement that access to veterans' health care providers should be based on actual drive times as opposed to straight-line mileage. Moreover, we agree that veterans should not have to wait more than 20 days for primary care or 28 days for specialty care. The American Legion does not oppose choice, but we adamantly oppose any plan that would gut the best health care system in the country. The central fact remains that nobody understands the unique health care needs of the veteran population better than the professionals at the VA. Further, the VA Mission Act must live up to its mission of serving veterans as opposed to serving private health care providers. To varying degrees, anyone who has personally assisted a close family member through sickness or serious medical conditions understands the challenges facing caregivers. I know I too have experienced this. We welcome the recent expansion of the VA Family Caregiver Program to equalize benefits so that family members providing care for Vietnam and other veterans are on par with those who provide it for members of the post-9/11 generation. However, gaps still exist. Regardless of when a veteran served, even if it was during a period of peace, caregivers still face the same challenges. They sacrifice career, time with others, and often their own health care needs to care for their loved one. The American Legion has always believed that a veteran is a veteran. Our gratitude for their service should not be measured by arbitrary dates, but rather by the simple fact that they swore an oath to defend our nation. It is time that loved ones who are providing care for their veterans achieve equality. And there's another area of equality that the American Legion would like to see addressed. A century ago, our organization was chartered by Congress to serve as the leading voice for the veterans of the Great War. The thinking at the time was that World War I was so horrendous that it was the war to end all wars. As we all know, history proved that it wasn't. Even so, our charter was updated during World War II to reflect the service and sacrifice of that era. Subsequently, our charter and membership eligibility have mirrored the eras officially recognized by the U.S. government to include the wars and conflicts such as Korea, Vietnam, and the global war on terror. However, these recognized periods fail to take into account the hostilities that occur between official eras in which nearly 1,600 U.S. military personnel were either killed or wounded in places like Cuba, Iran, and El Salvador. Because of these frequent engagements, the American Legion calls on Congress to declare what has demonstrably already occurred, that the United States has been continually engaged in a state of war from December 7th, 1941, until such a date in the future that our government may declare an end to all armed hostilities. Congress can provide this recognition by supporting and passing Senate Bill 504, or the Legion Act. The Legion Act will authorize the American Legion to expand our membership eligibility requirements. We sincerely thank Senator Kirsten Sinema of Arizona for making this the first bill she introduced as a member of the United States Senate. We also thank Senator Tom Tillis of North Carolina for joining Senator Sinema in introducing this bipartisan legislation. The veterans that the Legion Act will recognize have carried out their missions. Now it's our turn. In 16 days, the American Legion will officially turn 100 years old. You've heard me discuss mission quite a bit this morning. That's because the founders of our organization had a post-war mission. Their mission, one that continues today, was to care for veterans, provide patriotic youth programs, advocate for a strong national defense, and instill pride about what it means to be American. It's not just what the American Legion did, it's what we do. It's tempting to say mission accomplished, but that implies that our work is done. It's not. So I prefer to say mission still being accomplished, and I invite all members of Congress to join us in the mission to make a better America. Chairman Takano, Chairman Isaacson, ranking members Tester and Rowe, and members of the critical committees, thank you for holding this hearing. Thank you for all that you do for our nation's veterans and families. And thanks also to your amazing and talented staff. Mr. Chairman, I would happily answer any questions you may have, but I'd like to let you know that I am blessed to have sitting with me some subject matter experts who are available, and in the event that they can answer a question better than I can, I will defer to them with your permission. Thank you.
Thank you, Commander, for your testimony. We will now begin with questions from the chairman and then ranking members and then members from the committee in the order of arrival. I'd like to begin by recognizing my colleague from the Senate, Chairman Isaacson, for 5 minutes.
Thank you very much, Mr. Chairman. I appreciate the opportunity, and I want to thank the Legion for the fireside chat that we did on Monday, which was so effective way for us to communicate and get to talk to so many of your members. Congratulations again on your 100th anniversary. And for my benefit and my humoring, all the Georgia Legionnaires, please stand. We're all on the same team, and we're all in the same rank when it comes to being Americans and being Legionnaires and being veterans of the United States military, but we're always glad to have the Georgia veterans here. Congratulations on being here today. I only have one. I'm not going to ask a big question. I'm going to kind of make more of a statement because I think it's important that I repeat myself in the remarks I made first of all. Commander, do you have a successor here? Do y'all have a line of succession for commanders?
Sir, we do have candidates that are following, so there is a leading candidate for national commander that is behind me.
Is there a leading candidate? Who is that person?
That person can stand. It is Bill Oxford of North Carolina.
Good. I want to tell you why I'm doing this, and this is really important to me. Mr. Oxford and to yourself, Commander, your terms are 2 years or one? 1 year.
1 year, sir.
Over the next 24 months, the future of the VA's healthcare services and operation depends on our supporting the changes in the Mission Act, the implementation of the Mission Act, and holding everyone accountable, us in Congress, the physicians and nurses and assistants in the VA, and the VA administration itself. So I want to tell everybody, in a leadership position, either on these committees or in your organization, the Legion, nothing we've done is going to work unless you help us make it work. We're going to have to give the VA some time and some latitude to make a few mistakes. But as long as they're making mistakes of the heart, making mistakes trying to do better, that's fine. But when they make mistakes, we want to call them out, have them correct them, and then support them for the changes they made. I fear sometimes that bureaucracies wait for elected officials' terms to expire. So in other words, once I'm in office for 6 years as a senator. But when they go to work for the VA, unless they do something really bad, they're there for life. So they can outwait me. I don't want that to happen. We cannot afford to spend a day waiting for the promise of the improved appeals process, accountability process, physicians of the number sufficient to have VA health care reach every veteran in the country. We need all these things to become reality and not just promises. I'm pledging my part to support that. I know the members of the committees will pledge that. And if you, Mr. Oxford, and you, Commander, will see that starts in the chain of command in your organization. A few years from now, we'll look back on this being one of the great times of all for the VA and for veterans in America. Thank you all for your service.
Thank you, sir.
Thank you, Senator Isaacson. Both Senator Tester and I will take our questioning time later, but I want to now move to recognize a member of the House Committee, Mr. Cisneros of California, who himself is a Navy veteran. Mr. Cisneros, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Commander Reisted, thank you, and all of you, thank you for being here today. I especially want to thank the members from California who've made that long cross-country trip. Especially, I understand I have 2 members from my district, Martha Huff and Robert Brower, who are here representing California's 39th. So thank you all for being here today. I'm a proud member of the American Legion, Post 277 in Placentia. In fact, this hearing today is actually reminding me that I have to pay my dues this year. So thank you for doing that. But I'm also the grandson of veterans, the son of veterans, and as the chairman said, a Navy veteran myself. And I understand the importance that the VA plays serving veterans. My father is a veteran, a Vietnam veteran, who is suffering from the side effects of Agent Orange, and I hope one day his Navy counterparts will be able to get the same treatment that he's receiving from the VA right now. But it's also, the important thing for me that I worry about is the transition of our service members out of the military into the VA. My father also went over 30 years without being diagnosed that he was suffering from PTSD. And I don't want that to happen again to our current veterans that are serving in the service. So how, Commander Reisted and any of you, how can Congress support the VA is to make sure that we get a smooth transition from those that are leaving the military, active duty service, that they're transitioning and making sure that they're getting the medical attention that they need and deserve in the VA once they leave service.
Well, Congressman, thank you first for your question and for your service to our country. I believe it is essential that our military services promote transition at the end of a person's service. And I would like to ask our Director of Veterans Affairs and Rehabilitation to respond to your question, please.
Congressman, thank you for your question. I served 22 years as a Marine, and I saw the great care that our active duty folks get while they're serving in the military. What we hope is that they continue to get that great care through the VA. 9 million service members or veterans are enrolled in VA. We have 20 million veterans out there. We need to get them enrolled in VA. So what you can do to help us, to help our veterans, is to get them. VA care is the best care. Our members, our veterans prefer VA care over local care, and we believe that if we get them into the VA system, that they'll get that continued care that they deserve.
Thank you. So the other question I have is how we can be supportive, but VSOs, veterans organizations like yourselves, the American Legion and other organizations that are out there, how can Congress be supportive in helping to grow your membership to make sure that you have advocates that are continuing going on into the future, that will be advocating for our veterans into the future?
I mentioned in my testimony, sir, the bill that we refer to as the Legion Act. It's currently Senate Bill 504. Hopefully we'll see the same in the House of Representatives. That will enable us to be able to grow our membership. I think the American Legion is challenged in the coming years to grow, but we have great programs and great people in our organizations, and I'm very fortunate to know many younger veterans that are getting involved in our organization and moving up the ranks and promoting our organization to their colleagues, family, and friends. And I believe that we will have another 100 years of strong service to our country ahead of us. But I would like to ask our Legislative Director, Matthew Schuman, to elaborate, please.
Thank you, Commander, and thank you, Congressman, for the question, and thank you for your service. And with the time that you have left, I would agree. We are certainly looking for a member of the House of Representatives to introduce the House version of the Legion Act, and I'm happy to chat with you after this hearing to see if we can make that work.
I'd be happy to do that. I just want to thank you all again for your service to our country, and thank you all for being here today.
Thank you for your question, sir.
The gentleman yields back. I now recognize Senator Tillis of North Carolina for 5 minutes.
Thank you, Mr. Chairman, and thank you all for being here. I guess I have to start. I already heard, did I hear somebody mention it's already from North Carolina? It's coming up in leadership somewhere. We have any other folks from North Carolina here? There you go. Well, good morning. I want to cover a couple of things that I covered yesterday in the DAV meeting, because I think that you all are a very important part of us getting the Mission Act implementation right. One thing that's very important to me is that you all understand that Ranking Member Tester and I, with the encouragement of the Chair, Isaacson, have been meeting with the VA literally for about every 6 weeks since I've been here, to try and figure out what they're doing, what they're addressing as they've implemented new programs. So as we're moving forward, we're always looking forward to your input on things that we should cover in progress, any concerns, and then again, conveying information that we get from those meetings to you all is very important. The Director does a good job of staying in touch with our office. In fact, we ran into each other on the sidewalk today, but he's always walking the halls here and doing a good job. So we just need your feedback in a very constructive way, because I believe that the VA is moving in the right direction. We actually have a Secretary of the VA who I have a little bit of history with, who's also from North Carolina. He is the son of a gravely wounded combat veteran from the Vietnam War, and I think that he gets it, and he's got a big organization to run, so I'm sure constructive feedback from everybody, particularly you guys, would be welcome. I will tell you a funny story that I had yesterday, because it relates to the implementation and what the VA looks like, say, 20 years from now. Senator Sullivan, who's a Marine, and our good friends, he's from Alaska, and we were, I think, at dinner one night, and he told me, he said, "Tom, do you know that Alaska has more veterans per capita than any other state?" And I said, "Dan, do you know that North Carolina's got more veterans than you got people?" And the reason I tell that story was, one, I was jabbing a buddy of mine, but the other reason was to explain the vast differences and challenges that we have from state to state. We need a brick and mortar presence, and we need, as the commander said, one of the greatest medical systems to continue to operate in the mode that it operates today. But then again, we've also got to look at the unique challenges of a veteran who's in western North Carolina that may be 40, 50 miles away from a health care provider, and they're winding roads up in the mountains, or a veteran who's in Alaska in the far reaches. So we've got to figure out what fits for those states and have the flexibility to do that. But I don't believe, I always say in these meetings, anybody that says this is the year and this is the Congress where everybody's going to move to privatization, I don't get it. I don't believe anybody in their right mind is going to do that. But what we are going to do is make sure that when you have a need, that you get quality health care, and we want to give you every single option that we can to get it as quickly as possible. And I believe that's at the heart of what Secretary Wilkie and the VA are trying to do. I also am glad to hear that Congressman Cisneros is interested in trying to figure out how we increase your legions, because I'm kind of interested in that too. That's why Senator Sinema and I have sponsored the Senate 504, the Legion Act, and we look forward to getting our colleagues in the House to get on board with it. I think it makes sense, and we're happy to see that get to the President's desk. And then finally, I want to talk about the unique position I'm on. I've got a personnel subcommittee later today in Senate Armed Services, and I also agree with Congressman Cisneros. We've got to figure out a better way to connect the dots through transition. And we've got to find out a better way to identify what we consider to be traumatic events over the course, maybe not rising to a level of being recognized, but the cumulative effects of concussions and other sorts of injuries that can ultimately have an effect on someone's behavior, who served admirably until something clicked, and now they're discharged with bad paper. We've got to figure out a way how to actually deal with that in a fair and just manner, and I think that begins by spending a lot more time over the life cycle of the active duty reservist, National Guard, to make sure that we really understand what may have happened to cause that sad outcome, to give them the care that they deserve, because they also are disproportionately high on the suicide list, and we've got to change that. So I'm not going to ask you all any questions, but to say I appreciate you all being here today. The director does a good job. I think the best meetings are the meetings that we have in our office, so we can get back and get into the weeds with it, and I welcome you in my office every time. And next year, if you're stuck in a long line out of the sidewalk trying to get through, if you come to the Dirksen interest over here on the first floor, I'll give you a big pass and make the Capitol Police a little bit nervous. We let about 30 or 40 in today. Kind of short in the line. Thank you all for being here. God bless you, and thank you for your service.
Thank you very much, Senator.
Senator yields back. I now recognize a new member of Congress, the gentlewoman from Illinois, who brings a tremendous background of nursing and public health policy knowledge to this committee. Ms. Underwood from the state of Illinois, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Thank you, Chairman Isaacson, Ranking Member Tester, and Ranking Member Rowe for organizing this important presentation from the American Legion. I also want to thank Commander Reisted and the Legion for being here and your presentation today because of your invaluable insight and guidance that you provide into solving the challenges that our veterans face and their families experience across our nation. So since we're doing some shout outs, are there some Illinois veterans here today? Oh yes, thank you so much, so good to see you. And thank you for your continued service. I look forward to learning from all of you today and hope to meet with you in the days and months to come. I represent a community in northern Illinois outside of Chicago, the Illinois 14th, and in our community we have 36,000 veterans, 2,300 of whom are female veterans. And women veterans now comprise about 10% of the total veteran population, and those numbers are expected to grow in the coming years. And so my question really is, in the Legion's view, what does the VA need to be doing to ensure that female veterans are receiving the care that they need?
Well, thank you, Congresswoman, for your question, and thank you for being so gracious this morning to let me tell you I thought you were from Michigan.
Yeah, it's okay. I went to Michigan.
But I will say this, I got wrong information, but I did live in Illinois as well, so.
Excellent.
Appreciate your representation of Illinois, and to give you a little bit of background, our focus with women veterans is to ensure that they get the equality of services that they deserve. Mm-hmm. As I mentioned in my testimony, we are of the belief that a veteran is a veteran, and our female veterans deserve only the best quality care. And this would include gender-specific medical resources, mammography, gynecology, private treatment and exam areas, education and enrollment of more women veterans and an improvement of our outreach to them. And I would like to ask our Director of Veterans Affairs and Rehabilitation, Mr. Nuntavong, to respond further to your question.
Thank you, Commander. Congresswoman, the largest growing population of veterans is the women's population, and it's important that they receive the gender-specific care, as the Commander mentioned, that they deserve. But we hope that you can encourage VA to provide child care services in VA facilities and help VA find access to privacy needs that women veterans need as they come into medical facilities.
Thank you. And did you have any non-healthcare related issues that you wanted to just highlight related to the female veterans and any specific issues that we should be working on here in the Congress?
Yes, Congresswoman, thank you for that. I think we need to do a better job of ensuring all veterans get better access to VA, but in particular, female veterans. As you stated, this is the fastest growing demographic. And we need to certainly take care of our female veterans. I also certainly want to thank Congresswoman Brownlee and Chairman Takano for creating a new staff position that will take care of this.
Excellent, and I'd also like to commend Congresswoman Brownlee for her excellent leadership in passing this important child care bill. My next question is about the advancements of medical care, particularly related to the traumatic brain injuries and the post-traumatic stress disorder, two diagnoses that have become signature injuries from the global war on terror. Your organization has been studying these injuries for nearly a decade. And can you share any key policy recommendations that you have? I know you mentioned it, sir, a little bit in your opening comments on TBIs and PTSD that you would hope that the Congress can support your efforts in.
I'd like to ask our Chairman, Ralph Bozzella, of our Veterans Affairs and Rehabilitation Commission to respond to your question, Congressman.
Thank you, Commander. Thank you, Congresswoman. That's a very important issue, certainly for all veterans, certainly including women veterans. And one of the reasons for the mental health issues deals with the MST, TBI, PTSD, all the pressures that go with returning from a combat situation. In the American Legion, we have a TBI, PTSD committee. We are studying the issues. We have some publications on the issues, a booklet called The War Within, and The Road Home, and we'd be glad to share that information with you, as well as a white paper on suicide prevention. Although suicide prevention is a problem we talk about at the national level, it's a personal level, a family issue, a community issue, and I think all of us, Congress, the American Legion, VA, need to figure out how do we get this national issue down to that community level. That's where the work needs to be done. Thank you.
Thank you so much, and I yield back my time.
The gentlewoman yields back. I'd now like to recognize for 5 minutes the gentleman from Michigan, a former Marine Lieutenant General, helicopter pilot in the Vietnam War. General Bergman, you are recognized for 5 minutes.
Well, thank you, Mr. Chairman. That in Marine terms, that introduction is getting a little long. But that's another way of saying the chairman is acknowledging that I probably, as a young second lieutenant, flying infantry around Vietnam, I probably earned every one of these white hairs. So, you know, there was a mutual admiration society between the helicopter pilots and the grunts. They thought we were crazy for flying them. We thought they were crazy for getting out. So anyway, I'd like to ask this. This is kind of a generic question. I'm a member of the Legion Post in Watersmeet, Michigan, and a life member. And I'm curious. This is kind of off the subject matter, but yet it's very germane when you start talking about veterans and isolation after their service and where they go and reside. And one thing to be in a big city, another thing to be in a very rural community. But how's the Legion doing as far as propagating your membership on your roles, not necessarily the folks who come to the Legion, you know, the Legion Hall or whatever in these days, because the younger generations do differently. What's your plan to make sure those young veterans see the value in the Legion and get involved?
Well, thank you very much for your question. Mr. Chairman, our efforts to reach out to young veterans involve our own young veterans reaching out to them directly and to speaking to them about what the American Legion brings to the table to benefit them in their life and provides them with resources and programs that might benefit them. Camaraderie is very high on the list, but the American Legion has programs in 4 pillars, which include Veterans Affairs and Rehabilitation. It includes our children and youth and their children.
You still doing Legion baseball?
Legion Baseball is part of that program, the children and youth, correct?
Has there been any talk about expanding? Because I know, you know, baseball has always been a great sport, but has there been any talk within the Legion of expanding it to things like maybe soccer, lacrosse, or, you know, anything? Again, I'm looking at,
Yes,
we've
sir.
got 8 grandkids, 17 down to 10, and
Understood.
we look at their involvement and that the beauty of what the Legion and the leadership does with, when as a young 16-year-old, I mean, I was the benefactor of some guidance by some Korean War vets and some World War II vets. A little direct guidance, but.
Yes, sir. Mr. Chairman, for the last 6 months, I've had the opportunity to represent this organization and travel nationally. And one of the great things that I get to do in my travels is meet with the local American Legion posts. And it allows me to compare from one to the next and from one state to the next the different programs that we have. And it's not unusual at all for me to go to an American Legion post that sponsors sports outside of American Legion baseball, little leagues, soccer leagues, and such. But also the beauty of our organization is that the posts are autonomous, which means they are given the breadth to be able to create their own programs.
I don't want to cut you off here because I appreciate your answer and the autonomy of the posts, because what we might do in the Upper Peninsula of Michigan may be different than what someone might do in downtown Dallas,
right,
whatever it happens to be. And I apologize if someone has already asked this question, but I want to goes back to the isolation in rural areas. The subject of, I'd like to hear your thoughts on telehealth when it comes to delivery of health care, whether it be physical, psychological, whatever it happens to be. Any thoughts from a Legion perspective on where we are in telehealth and where we need to go?
Yes, sir. I have had the benefit of actually seeing the telehealth program personally out of the Minneapolis Veterans Affairs Medical Center, and it's truly a phenomenal program, and I've seen it also from the hospital room and how it functions. But I would like to ask our chairman, Ralph Bozzella, to respond in more detail to you regarding your question.
Thank you, Commander. Mr. Bergman, I'm one of those grunts you used to drop off in Vietnam. Yes, we did get out of those birds. And the telehealth program we're finding is an excellent tool to be used, obviously, to cut distance for certain examinations, primary care, mental health treatment, actually, in mental health, general examinations, and other more specific things. They're used at telehealth centers, much easier to build, much less expensive to run, with a nurse practitioner or a PA, and then connected to a provider, you know, hours away. So it works well. We think it's a great program. We want to continue to see the development of that program.
Thank you. And Mr. Chairman, I apologize for going over my time, but I yield back.
The General yields back. I now would like to recognize my fellow Californian and chair of our Economic Opportunities Subcommittee, Mr. Levin, for 5 minutes.
Thank you, Mr. Chairman. I am so grateful for the opportunity to be here today and so grateful to all of you for everything you've done for our country. And thank you, Commander, in particular. I take my new responsibility as chair of the subcommittee, House Veterans Affairs Subcommittee on Economic Opportunity extremely seriously at a time of rancor and partisanship in our country. This subcommittee and the greater work of the Veterans Affairs Committee provides us the great opportunity to get things done on a bipartisan basis, and I'm very grateful to be able to work with you and your team in the months and years ahead. My district is in Orange and San Diego counties. Right in the middle, we've got the amazing Marine Corps Base Camp Pendleton. It is absolutely essential part of our district, and many who serve at Camp Pendleton really like the weather and decide to come back, so we have one of the largest veteran populations in the entire United States. And there are a lot of our veterans who are instrumental members of our cities, of our communities. There are others who need help as they transition to civilian life after their service. And my district has a lot of exceptional organizations doing that work. I think in many ways we are a standard for what can be achieved when we see our veterans as part of an integrated whole for our communities and our economy. I hope that together we can make progress on all sorts of opportunities for veterans. The GI Bill, issues around vocational rehabilitation, homelessness, home loans, and a lot more. And with that in mind, I just had a couple of questions for you. I am concerned, and one of the things I hear a lot from our local veterans is the targeting of service members and their families by for-profit schools, specifically incentivized by the 90-10 loophole that doesn't count GI Bill payments as federal payments, but rather has them count towards the 10% of funds that for-profit schools need to receive as non-federal payments. This can and has led to for-profit schools pushing for enrollment of student veterans through the GI Bill, but not providing the quality education those student veterans need and deserve to succeed in their transition from military to civilian life. So, Commander, has your organization seen these or similar issues, and do you support the closing of the 90-10 loophole?
Thank you for your question. I would like to defer your question to one of our experts here at the table, and that would be Chairman Triola of our Veterans Employment and Education Commission.
Thank you, Congressman Levin, for your question. I'm pleased that you asked that question. We right now at the American Legion have a resolution in place to close the loophole for the 90-10 discrepancy. The American Legion looks forward to working with you to try and close that loophole.
Fantastic. And, you know, we're also concerned about some of the issues surrounding the implementation of some of the provisions in the Forever GI Bill last fall, and we'll be following the implementation this year very closely. I'm focused on the underlying problems that created the situation, specifically the aging information technology infrastructure in the Veterans Benefits Administration, the poor communication at times between the Office of Information and Technology and the business line customer, which resulted in inaccurate contract requirements that did not accomplish what was needed to implement Sections 107 and 501 of the Forever GI Bill. My question for you, Commander, is do you have any recommendations on what our subcommittee, the Economic Opportunity Subcommittee, should focus on as we ask the VA for its plan to modernize the Veterans Benefits Administration's IT systems?
Yes, sir. With your permission, I would like to ask our chairman of our director of legislation, Matt Schuman, to please respond.
Well, thank you for that question, Congressman. I think it's incredibly important for the Culinary GI Bill, which was named after the American Legion past national commander who wrote the original GI Bill, to be implemented correctly. That's certainly the intent of this of both of these committees. Focusing on the IT side of things, which is where we believe the errors took place, is absolutely critical. I think we need to focus and make sure that the new IT systems are implemented and that there's one system that works instead of hopping between multiple systems to be able to process the GI Bill benefit.
Terrific. Well, I'm really excited to be working with you and look forward to subsequent discussions, and very grateful to you all for your service. Thank you so much.
Thank you for your question, sir.
The gentleman yields back. I'd now like to recognize the gentleman from Alabama, Mr. Sullivan, for 5 minutes. Alaska-
Chairman,
I'm sorry, Alaska.
so, Mr. Chairman, I'm gonna ask a little bit about any of my fellow veterans from Alaska here. Can you raise your hand? How about a round of applause? Now, these guys, I'm gonna talk. I know Senator Tillis, my colleague from North Carolina, was here a little bit earlier talking about size and numbers. So, look, I'll just be honest. My fellow senators get a little nervous when I broach the subject of size, being the senator from Alaska. So, my fellow Alaskans flew about 5,000 miles to get here, so I appreciate that. And we do have more vets per capita than any state in the country, which I'm also very proud of. And but I think it makes guys like Senator Tillis nervous, so I won't talk about the fact that Alaska is actually 13 times larger than the state of North Carolina. But so for you North Carolinians here, I'm sorry, but you can send that back to your senator when you. In general, I appreciate your comments. Being a grunt myself in the Marines, not a Vietnam vet, but somebody who's been taken around by a lot of our amazing pilots. I want to thank you for your service, and all of our Vietnam veterans, because they've done such a great job, and so we want to thank you. But I wanted to touch, Commander, on this topic that I think we all care quite a lot about. Actually, it was the first bill I co-sponsored as a U.S. Senator 4 years ago, the Clay Hunt Suicide Prevention Act, which was named after a Marine who unfortunately took his life. What, in your view, are we doing in terms of suicide prevention programs that's positive? And then where are we still falling short? Senator Blumenthal and I are introducing the Reach Every Veteran in Crisis Act today, which again looks at filling some of the gaps as it relates to suicide. But can you expound upon what more we should be doing?
Yes, sir. Thank you for your question. We are trying to promote the enhancement of outreach and awareness to our veterans, not only externally, but also within the VA. We want to promote the education of signs of potential suicide, and to promote the resources that are available so we can refer those at risk to the appropriate places to get health assistance and mental health assistance. Expanding and promoting mental health care treatment and increasing staffing for the VA's Integrative Health and Wellness Program. And I would like to ask Chairman Bozzella if he can add to that list.
Thank you, Commander. Senator Sullivan, this is a problem that everybody has the greatest concern about. This is certainly the top of our list of the American Legion, too. And earlier there was discussion here about the 14 veterans a day out of the 20 that commit suicide, those 14 who aren't even connected to VA.
Yeah.
You know, that some of those veterans, the reason they're not connected to the VA, they're reserve and guardists, they don't have the benefit. Or other veterans that may not be eligible for the benefit of mental health through VA vet centers and so on. So that's one. We have to look at why do people commit suicide? Mental health issues, certainly, a loss of purpose, a loss of a sense of belonging, and that's where VSOs can certainly help with that. We have to get this, as I said earlier, to that community level. I think one of the ways we can do that is through American Legion and VSO Post Homes. There's the initiative out there right now, the Governor's Challenge. 7 pilot states, I know Montana, Colorado, Kansas, Texas are among those. And that effort is to get VA to train people. How do we recognize someone's at risk? How do we then connect them to a VA service? So we're working closely with that. I personally will be involved with that in Colorado, and I'm looking forward to working on an effort that'll bring it locally.
Great. Well, listen, you know, one of the, I like to brag about my state with regard to our veteran population, but we also, like a lot of states, like a lot of big rural states, have a big suicide problem in Alaska. And so I would be honored if all of you gentlemen could take a look at our Reach Every Veteran in Crisis Act that we're introducing today, and just give us your views and thoughts on what you think is good in it, what you think needs to be improved in it. But we can always improve on this issue, and it's a heartbreaking issue, and no American wants this to happen, and I appreciate the VSOs for all your attention to it, and I think you see here a lot of bipartisan support for addressing this challenge, which we got to do better at. So thank you, Mr. Chairman.
The senator yields back, and I wanted to acknowledge the senator's service to our country, his military service. So thank you, Senator. I'd now like to recognize my fellow Californian and chair of our Subcommittee on Health and chair of our new Women's Veterans Task Force, Ms. Brownlee of California. You're recognized for 5 minutes.
Thank you, Mr. Chairman, and I want to add my voice to welcoming all of the California Legionnaires who are here today. And Commander, I want to thank you for your leadership, all your past commanders, the American Legion Auxiliary. Thank you for your leadership, and the leadership really, quite frankly, throughout the country that the American Legion does for serving our veterans across the country. And I certainly appreciate, Commander, when you talked about your mission, that we can't say mission accomplished, but perhaps mission still being accomplished, because I think we have accomplished a lot, but we still have a lot of work to do. And I think it's important that we need to do more than simply thank you for your service. We need to ensure that we are servicing every single veteran appropriately and positively across our country. And I am very excited, and I'm grateful to Chairman Takano for allowing me the opportunity to lead this Women's Task Force. And I think we are going to do some very good work, and I look forward to working with the American Legion on this, and I know you're going to be very helpful in our mission to make sure that we are meeting the needs of our women veterans and their unique needs. I know Congresswoman Underwood talked and asked some questions, and I know that women veterans are a high priority for the American Legion, and as I said, I'm looking forward to doing that work. I think when we're talking about women veterans and meeting their needs, I think there are probably challenges that can't necessarily be fixed by legislation, but perhaps can be improved upon in terms of, cultural changes. And I think one of the bigger challenges that I see, other than, gender-specific health care and other issues, is how do we make sure, how do we reach out, how do we make sure that our women veterans are actually identifying as veterans and coming to the VA for services? And I don't know if anyone can really speak to that, but I think we just talked about the suicide rate amongst our veterans, both men and women. Commander, you talked about the women's suicide rate being twice what it is in terms of civilian suicide. The chairman talked about the amount of veterans who are not using the VA, who are committing suicide, and we obviously know what that gap means. I'm wondering if you have a similar statistic with the women veteran population in terms of their suicide rate, and I'm assuming that the population is even greater in terms of the women committing suicide that have not reached out to utilize services from the VA, but I'm just wondering if you actually have that statistic.
Senator and Chairman, I'm afraid we don't have that information available to us right now, but we would be more than happy to obtain that and get it to your office as quickly as possible.
Thank you very much. And I just think that I'm really looking forward to this work on the task force, and we hope to culminate that work by having a large piece of legislation articulating to better meet the needs of women veterans. But I think women's suicide is of particular concern and a very, very high priority. Can you speak a little bit to some of the barriers that you see in terms of women reaching out to the VA for their benefits?
With your permission, I'm going to ask Chairman Bozzella to answer your question. He has more expertise in that area.
Thank you, Commander. Representative Brownlee, you have taken care of one of the barriers with the Child Care Act. In 2013, our American Legion System Worth Saving program dedicated the whole year of visiting VA hospitals for the purpose of assessing the women veterans' health care situation at the time. Even though that was 6 years ago, some of those barriers still exist. The privacy issues, the lack of gender-specific care, the entrances, the 3 levels of women's health care, which we're not going to go into right now, and how those are set up in a VA. But VA did authorize a mandate, a women veterans coordinator in every VA medical center. That was a key component to getting things moving. Things are absolutely improving. Are they where they need to be? No. But that process has to continue. I think your task force is a great idea, and we still do system worth saving visits, of course. We don't dedicate it to one subject, but on every visit we do, we have a women's veterans coordinator interview, and we check their program out. And I would like to invite you or a task force member to accompany us on one of our system worth saving visits or more, and you can see firsthand how we conduct that and how we can interact with women veterans. That will provide you with a great deal of insight.
That's excellent. And Mr. Chairman, I know I'm over my time, but I would be remiss. I want to make sure that the commander knows how well Director Schuman and his colleagues represent the American Legion here on Capitol Hill every single day. So thank you for that, and thank you. I yield back.
Thank you.
The gentlewoman yields back. I'd now like to recognize the senator from Arkansas, Mr. Boozman.
Thank you, Mr. Chairman, and thank you all of y'all for being here. As I said with the disabled veterans, you know, we work hard in a very bipartisan way to push things forward. Nothing helps more than having a full room. And so thank you all for being here. Thank you for taking the time, traipsing these halls, getting lots of steps in, you know, in the last few days, but there's simply no substitute for that. And we appreciate you so much, Commander Reistag, and then also your team, not only your team that's assembled here today, but the team that's been assembled for many, many years, year after year, you know, doing the great work, and we can be very, very proud of the fact that we've been able to keep more and more promises that have been made. We always have to remember that these aren't give-me's, these are earned benefits. And so, again, we appreciate your service. Nobody does a better job than those from Arkansas, and we appreciate their efforts. Wave to me if you're I won't make you call the hogs, but we do appreciate you being here. So thank you so much. I'd like to talk about just a couple things real quickly. And, you know, the themes are here. One of them is suicide. We've been talking about that all day. It's so very important. One of the things that I'd really like to concentrate on this committee and then on the Appropriations Committee, we're spending lots of money on suicide. That's a good thing. But we don't seem to be moving the needle, you know, a whole bunch. Every year the statistics seems to be the same. So one thing that we'd really like to concentrate on is evidence-based, you know, things that are actually making a difference, you know, putting the metrics in place. So I really don't have a question about that. What I'd like is a commitment, just that you can help us in that regard, again, to insist that we make sure that the dollars that we're spending, and we are spending lots of dollars in this area, making sure that we have the evidence and this and that are backing that up so that we can move the needle in the future. suicide is such a difficult problem. You know, it's a hard nut to crack, but I do think that would be helpful. The other thing I'd like to talk a little bit about is homelessness. And in your testimony, you talked about people that PTSD, people that were felt like they weren't a part. All of the different things that contribute to that, not only with suicide, but also with homelessness too. And so I guess my question in that regard is as I said, we're spending a lot of money in that area. Can you talk to us a little bit about any ideas you've got as to how we can do a better job in that regard?
Yes, sir. There are several things that we can do. As far as homelessness is concerned, we can invest in affordable housing, supportive services for our veteran families, and transitional resources to help our homeless veterans get back on their feet in their communities. But I would like, with your permission, Mr. Chairman, to ask Chairman Triola of our Veterans Education and Employment Commission to respond to that question as well.
Thank you for your question, Senator. The American Legion focuses more on prevention than the actual homelessness itself. We feel that if we get them before they hit the streets,
That's a good point.
that we have a better success rate. We offer support for at-risk veterans during the transition process, and also homeless veterans that have been out there for a while. What we try to do is we try to get them help with health care, help with veterans benefits, counseling, advice that they may need. We recommend that Congress continue to fund the Homeless Veterans Transitional Housing Program at the level of needed demonstration in their local communities.
Very good. Commander, we've got the access standards, the proposed access standards regarding the Mission Act, and it seems like, that's being something that, is accepted, moving in the right direction. One of the promises that was made in regard to, as we went forward with these things, is having the ability from input, from you and others. Have you all been pleased with that? Have you been able to give any input in regard to the standards? I do think, you all are the ones, the answers need to come from the bottom up, and I've had a little bit concerned in that regard. Can you address that very quickly?
Yes, Mr. Chairman, if I can defer to one of our resident experts here at the front table, I would like to ask Director Schuman of our Legislative Division to respond to that question.
Thank you for the question, Senator. We have been engaged. We've Secretary Wilkie himself has come over and met with our executive director and our Veteran Affairs and Rehabilitation team to be involved. We very much look forward. You will find no greater friend in the American Legion to vigilantly be aware and watch how these access standards are being implemented. And in the first second we see veterans not being treated and receiving the care they need, we will be knocking on your door.
Good. Thank you, Mr. Chairman.
The senator yields back. I'd now like to recognize the Senate Ranking Member of the Veterans Affairs Committee in the Senate, the gentleman from Montana, Senator Tester.
Well, thank you, Mr. Chairman, and once again, thank you all for being here. We've talked about suicides, and there was a point brought up earlier, I think, by you, Chairman Mozella, that guardsmen and reservists aren't eligible for mental health care or vet centers. I got a bill that'll take care of that, and it applies to both reservists and guardsmen. And it applies to them even if they haven't been deployed, which I think is also critically important. We have not introduced it in the 116th yet. I need a partner on the Republican side before we're going to drop this bill in, because it needs to be bipartisan. So I just want to bring that out, and hopefully we can get some folks to jump on board, because one suicide is too many, and we've got far more than that. Commander Reistad, I just kind of want to get your general views on the VA healthcare. Would I be correct in saying that a majority of your members prefer care directly from the VA? Would that be a correct statement?
Yes, that would be a correct statement.
Okay. Do they believe that, do you believe or they believe that community providers should be held to the same standard as VA providers?
Absolutely, they should.
And when it comes to expansion of care, would the American Legion be alarmed if access into the community meant a reduction in quality or timeliness of care for your membership?
Well, with all due respect, sir, whether you know it or not, today is National No-Brainer Day. And I would have to say that that's a no-brainer.
Perfect. That's what I was hoping for. Well, I mean, those are things we've got to be aware of, because the truth is that the VA does get a lot of criticism, but they do a lot of stuff really well.
Absolutely.
And the fact is that when we go into the private sector, if we're making wait times better but decreasing quality care, we didn't win. If we're making wait times longer, we didn't win. So those are important things moving forward, because I think the VA, we need to, my personal opinion, I think most people's opinion, and I think certainly the American Legion is build capacity within the VA, make it all it can be, and then if it can't meet the needs, put them out in the community. I want to talk about the budget for a second. Normally we have the budget by now. We don't have it quite yet. But I would like to give the American Legion an opportunity to talk about what their priorities should be in this fiscal year's budget.
Well, thank you for the question, and Mr. Chairman, I think this question would be better answered by our Legislative Director, Mr. Schuman.
Well, thank you for the question, Mr. Ranking Member. I think all of our priorities are right here. I think when it comes to the VA budget, it was shared several months ago that the President's administration asked for a 5% cut to all federal agencies, and instantly the American Legion began engaging senior leadership at VA and, of course, the White House to say this is not a time to be cutting any budget from the Department of Veterans Affairs. This is a time to ensuring that we keep the promises made to the men and women who have selflessly raised their right hands.
Well, thank you, and thank you all for what you do representing the fighting men and women in this country. I appreciate your testimony. Thank you, Commander Reistad.
Thank you.
The Senator yields back. I now would like to recognize the gentleman from Louisiana, Senator Cassidy, for 5 minutes.
Thank you, Mr. Chairman. Any of my folks from Louisiana still here? I think I saw, oh yeah, thank you. If Sullivan was still here, I'd tell him every Sunday I teach Sunday school. I actually teach first graders, so it's more riot control. But one of the fellows goes up to Alaska regularly, and we always look at the weather in Nome and Anchorage and compare it to Louisiana. I can tell you folks in Alaska, come down to Mardi Gras this time of year, you know, and I think you'll be less likely to die from cold exposure. I'm a doctor. And so as we've spoken of, suicide and mental health matters a heck of a lot to me. But I'm going to take it from a little bit of a different approach. Chairman Bozzella, you said something earlier. You spoke of that sense of purpose that some folks leave. Now, the literature shows that the greatest risk for suicide is within the first year or so after separation from the service. And one thing that's great to see is some young folks in your audience, because obviously you need that connection with those who are just leaving the service. But I remember seeing a video of one man who had attempted to commit suicide, and his wife found him, and he was hanging himself, and she picks him up and somehow gets him off. Incredibly moving. And they were interviewing him afterwards. He said, I didn't quite know what I was doing. All I know is that a year ago I was a Marine, and now I was fill in the blank. There was not that sense of purpose. Now, then go to another conversation I had this past week with a major employer in my hometown of Baton Rouge, and I think they tell me that they are the leading employer of veterans. they do construction work, pipelines, and civil engineering, and they find it's team, it's a goal, it's responsibility, it's a mission, it's authority, and so everything that gives that sense of purpose. Now, why do I go into this? One, it's important, but secondly, the way they've achieved this is they hired someone who was experienced with the bureaucracy, that knows how to get a veteran about to, a service person about to be released and put them through the training program they may need in order to have the skill set in order to then join their company. And I thought to myself, I'm so glad you're doing it, performance contracting, but why do you have to hire somebody specifically to make it happen? What can we do to streamline it so that that veteran who is, the person who's about to be a veteran doesn't need someone to guide them through any more than, as you check out, this is what you can do. Do you follow what I'm saying there? Any comments on that?
Commander? Okay with you. Thank you, Commander, and thank you, Senator Cassidy. With the sense of purpose also comes a sense of belonging. There were two issues there, and they go hand in hand. And that Marine, a year later, is wondering, who am I, what am I doing? One of the ways to gain that sense of purpose is to continue to serve. And people who've joined our military, they serve. And when you get involved in the Veteran Service Organization, the American Legion, believe me, we'll put you to work. You will find a way to serve. That's one way. That's a streamline, one of the ways that I see it. I'm a combat veteran to Vietnam. When I came home, I went through that. I know what it is to live it, and it took a while to find myself through that. And one of the greatest ways I found myself was through being able to serve other veterans. That became my sense of purpose, even though I was employed in a different field. And I was able to develop that. And I see that with a lot of younger veterans when we're able to talk to them. So how do we connect them to those kind of employment opportunities? I believe that probably would be something that our employment people at this table could answer that better.
Yeah.
With your permission, Mr. Chairman, I'm going to ask Chairman Triola to respond to that.
So, Senator, we spend quite a bit of time with our small business task force in terms of engaging and certainly credentialing as well. We meet with and work with the Department of Defense. Really, we just had a meeting with Sergeant Major of the Army, Daly, who's doing a wonderful job in transitioning and finding credentialing programs. We want to be able to make sure, and really in partnership with small businesses and our credentialing roundtables, that we find the best practical ways to transition so that when these service members leave, they have a certificate and really a means to be able to find that purpose that you're mentioning.
Well, thank you for that. One bill I sponsored in the past when I was in the House was to allow those folks trained as EMTs in the military to get credentialed whichever state they went to with minimal hassle, figuring this great training they've had would help address a shortage that we have in our person power, if you will. So if you have those paradigms, Director Schuman or Commander, please share them with me. Again, I thank you for all you do. Our country would not be what it is without you. Appreciate it. I yield back. Thank you.
Senator yields back. I now would like to recognize a new member of Congress from the state of New Hampshire, Mr. Pappas, for 5 minutes.
Thank you, Mr. Chair. Thank you to Ranking Member Rowe and Commander Reistad. It's a pleasure and an honor to be with you as a grandson of 3 World War II veterans. I honor the service of our men and women who have worn the uniform of this country, and it's an honor to be a part of this committee and to be working with you, your leadership, your membership, and veterans advocates across this country to ensure that we get implementation right of so many of the key strategies that have been put into law in the recent past. And I think that's a common theme you're hearing here. This is where the rubber hits the road in this term. As the chair of the Oversight Subcommittee of the House Veterans Affairs Committee, I want to ensure that we're doing that in a responsive way for the veterans of this country, that we're honoring their service and ensuring that we're providing the best care possible. One of my concerns as someone from the Granite State, which is not as big as Alaska, but is mighty in terms of its veteran population. We have 14,126 members of the Legion in my state. is that we're meeting their needs in terms of pain management and ensuring that we're not seeing the type of over-prescribing and linkages to the opioid crisis that have been unfolding in tragic ways across this country. We lost 72,000 individuals in this country last year to overdose deaths because of opioids, and many of those are veterans. So I'm wondering how you can assess the response of the VA to this crisis and what potentially community partners can learn from the VA's experiences.
Well, Congressman, thank you first for your question, and with the consent of the chairman, I'm going to ask Chairman Bozzella to respond to your question.
Thank you.
Thank you, Commander. Congressman, the pain management issue is a major issue across our country. Obviously, opioids, some people think, is the #1 a problem in this country because of the addiction that comes along with that. Also, the psychotropic drugs that are used for PTSD, and by the way, there is not a magic PTSD pill. And most of those drugs have adverse effects on people too. So that we need to do a better job of finding the treatments that'll work for people. One of the aspects that we're looking at that we investigate in the American Legion through the VA are the complementary and alternative medicines. The yoga, music, equine therapy, fly fishing. I mean, it may sound trivial, it is not. That's one of the ways that people can manage their pain. Pain management clinics, VA has those kind of clinics. So that the advocacy is to move in that direction and away from the kind of drugs that are causing a lot of problem with people these days.
Thank you. I appreciate the response. One of the issues that the Legion members from New Hampshire raised with me is a problem that they've seen with arbitration clauses that prevent reservists who are returning to their jobs after serving on active duty from getting back into the role that they once had. And I'm wondering if you've seen this on a national scale.
Congressman, I'd like to ask Director Schuman to please respond to your question.
Thank you.
Well, thank you for that, Congressman. We really appreciate the Granite State as well. I'll say this, yes, we have seen it as an issue, and we need to find a way to create a partnership between you and us in terms of finding a way to prevent USERRA rights from being thrown away. If we don't have the ability, and private companies don't have the ability to take away our First Amendment rights, they shouldn't be able to take away our USERRA rights either. These people, these members of the armed forces serve honorably, and we promise them that we will protect their jobs. Finding a way to, federal legislation to prevent arbitration clauses is probably the step in the right direction.
Thank you. One final question. In my state, we have a 2.5% unemployment rate, which is great, but it makes it hard to recruit and retain medical professionals. And a recent GAO report found that over 10% of full-time and authorized budgeted positions are vacant, and that means about 45,000 vacancies across this country. I'm wondering if you know of some ways that the VA can continue to work to attract highly qualified medical professionals to fill positions and offer the care that veterans need.
Well, thank you for the question. Sir, I'm going to ask our Director of Veterans Affairs and Rehabilitation, Mr. Nuntavong, to please respond to your question.
Thank you.
Thank you for your question, Congressman. The pay disparities between VA physicians and physicians in private care is drastic. We need to find a way to fund the VA physicians and healthcare providers better. That's the bottom line.
Dollars and cents. Thanks so much.
Okay.
The gentleman yields back. I now would like to recognize the gentleman from Kansas, Senator Moran.
Thank you very much, Mr. Chairman. Thank you, Commander, for your presence here and for your colleagues with you. I had the opportunity to meet with members of the Kansas American Legion yesterday in my office, Dan Wiley, Dave Warnken, and Gaylord Sanneman. We previewed the conversation we might have today, and I appreciate every year that you and the members of the American Legion come see me. I also know, Commander, I know former National Commander Mike Helm very well at Kansan, and I recognize the tremendous amount of work that goes into the job that you have, and we welcome you when you visit our state. You have more credibility, Commander, than I do, but I think the American Legion and I are on a mission together. You have been, the American Legion has been an ally in everything that I can think of we worked on in regard to veterans. for as long as I've been in Congress, but I want to give you the chance to help me get a piece of legislation passed. Today, I introduced with a number of my colleagues legislation called the Fairness for Korean DMZ Veterans Act. What we've learned is that there are veterans who had exposure to chemicals, to Agent Orange, in the Korean DMZ prior to the the presumptive date of April 1968. Evidence from the Department of Defense that shows that testing and spraying of Agent Orange and other herbicides was being conducted prior to that April 1968 date, and yet the VA has not changed its current dates for that presumptive eligibility to reflect those instances of earlier exposure. So this legislation corrects that mistake, that error, requires the VA to recognize the facts as we now know them, and in the process take care of many veterans many military men and women who were exposed to something that is very dangerous to them, and I might add something that can be very dangerous to their children and grandchildren. It is, I have every expectation that every man and woman who served in our military knew that they were risking themselves, their own lives, and their own futures. What a tremendous burden it must be to know that your actions in serving our country could have caused harm to your children and grandchildren, something that no one would ever want. So we've worked on a number of instances to try to deal with Agent Orange and other chemicals. And Commander, I believe that the American Legion supports this legislation. If you say yes, I'm going to ask you to explain to me and to my colleagues why.
Well, Senator Moran, absolutely yes. And let me just go back about a week in time to my travels in Mississippi. I had the occasion to sit with a veteran at a function that we were at who began a conversation with me regarding this very issue. He served in the United States Army in 1967 along the DMZ. And he informed me that while he was there, he observed the defoliant Agent Orange being sprayed along the areas that he was situated at the DMZ. And he inquired about the status of the legislation, the prior legislation that you had introduced into Congress. And I did some quick searches on my smartphone and came up with the legislation and the information he requested, and noticed that there was no traction on that. I guess it never got out of committee for a vote, and he was very disappointed to hear that. And the man obviously had obvious Parkinson's. He was shaking, and he expressed great concern over that. And that, I think, is where the wheels went in motion, and I made it a point to convey those concerns to our legislative director sitting beside me, and it was through his efforts that your office was contacted, and this legislation will again be introduced. And I'm so thankful for that, and I assure you he will be as well.
Thank you for relaying that story. I would tell you our previous efforts, our continuing efforts in regard to Agent Orange and other toxic chemicals, we have had some success, and portions of that legislation have become law, pulled out of that legislation and passed with other pieces of legislation, including the more declassification of Department of Defense records, so that a veteran can better access and prove his case or her case of where they were stationed and what their chances of exposure to those toxic substances were. And the medical research has now been conducted that further demonstrates the connection between generations and exposure to Agent Orange. So we're setting the stage for additional opportunities for Congress and for the American people to support those who served our country and served it in a way that caused them to be exposed to chemicals very dangerous to their health and perhaps to their family's health. So, Commander, thanks for being an ally in this regard, and thank you for your endorsement of that legislation.
Thank you, sir.
Senator yields back. Senator, I want you to know that the Korean war veterans exposed to Agent Orange are covered under Section 3 of my bill, H.R. 299. So look forward to working with you. I now would like to recognize the gentlewoman from Hawaii, Senator Hirono, for 5 minutes.
Thank you very much, Mr. Chairman. I join all my colleagues in thanking all of you for being here today for your service. And I would like to give a shout out to the folks from Hawaii. And if you're still in the audience and can stand, I'd like to recognize John Williams and David Carlson from Hawaii. They came a long way to be with us. Mahalo. Commander, last year, as you mentioned, we passed very important legislation, the VA Mission Act, to overhaul the choice program. We want to make sure, though, that we're not heading toward privatizing, as you put it, the greatest healthcare system in the country. So I wanted to get your thoughts on a specific thing that's happening under the implementation of the Mission Act. And the VA recently released the proposed access standards for community care under the Mission Act. And are you at all concerned that the access standards, which I assume you're familiar with what I'm talking about, as a proposed could move us toward privatizing the VA system?
Senator, thank you for your question, and with the consent of the chairman, I would like to ask Chairman Bozzella to respond.
Thank you, Commander. Thank you, Senator. The Mission Act, of course, is on everybody's radar screen, very high. The American Legion worked hard on the Mission Act with other entities of Congress and VA to make this a reality. I think the first thing that we always need to keep foremost in all of our minds is all care through VA is VA care. We sometimes seem to forget that when we talk about care in the community or non-VA care and those kind of terms. And when it comes to whether or not that's privatization, we are carefully monitoring every aspect of that to ensure that if it turns into privatization, we will raise the flag. The thing about VA care is as long as we know that it's VA care, if there's problems, and somebody was mentioning earlier, there's always going to be problems, a new system coming on and all that, we know where to go. We're going to go to VA as a VSO, as a leading VSO, to work with them to help fix that problem. We're going to be here to testify before you about those problems. If it's all privatized, who do we go to? So we have to remember, we've got to work hard to keep it VA care. And we are familiar with the access standards. We've had some input into that. And the one concern that we have is urgent care and the $30 co-pays on the third visit. We're not going to be in acceptance of any co-pays for service-connected disabled veterans.
Thank you very much. Commander, I'm glad that you mentioned that suicide prevention is still a major factor, a major concern, and that suicide rates are going up. So there was a GAO study regarding what the VA is doing in preventing suicides, and so I do thank Senator Blumenthal, who's right here with him, not to steal his thunder, but under his leadership, Senators Bozeman, Tillis, who you heard from earlier, and I will be introducing tomorrow, Reach Every Veteran in Crisis Act, and this bill does make reference to the GAO report and the shortcomings in the VA. So we're on that page with you, Commander. There was also a reference to the telehealth services because much of our country is in rural areas, and it's an issue that Senator Ernst and I took up, and there was a provision in the Mission Act to allow for more telehealth, and I'm glad to know that it's working out and that you'd like to see that further developed. So, the other questions were already asked, but we're on the page with all of you. Thank you so very much for being here. Mahalo.
Thank you.
Yield back.
The senator yields back. I'd now like to recognize the gentleman from Vermont, Mr. Sanders.
Thank you very much, Mr. Chairman. And let me thank Commander Reistad for being here and your fantastic staff.
Thank you.
And let me thank all of the men and women in the room. You have done something above and beyond what human beings are normally asked to do. You have put your lives on the line to defend this country, and all of us are deeply grateful to you. And it seems to me, having made that commitment to this country, we owe you nothing less than, among other things, the best quality health care that this nation can provide to anybody. You have deserved that, and we thank you for that. And I also want to thank the Legion, not only for the great work you do on veterans issues, but what you do in our communities. In Vermont, for example, your Boys State and Girls State program are very, very important. I worry very much that a lot of the young people in our country, the kids in this country, don't understand what you have put your lives on the line to defend. They don't know what the Constitution of America is about. They don't know what democracy is about. And you do a great job in a very nonpartisan way in Vermont in getting kids to think about these important issues. So thank you very much for doing that. I had the honor of being chairman of this Senate committee a number of years ago, and we tried to do our best to expand VA health care. Didn't quite get the support that we wanted, the bipartisan support that we wanted. But there was one issue, two issues actually, that we raised. One where I think we've had some success, one not so much success. When we talk about health care, it has always seemed to me that dental care is part of health care. All right?
Absolutely.
And I can tell you that in Vermont, you got a lot of veterans who have serious problems with their teeth, and if you have dental problems, that could lead to other health problems. And one of the things we tried to do is to make dental care a part of VA healthcare, not just for service-connected folks, but for every veteran who accesses VA healthcare. Commander, is that something that makes sense to you?
Chairman, thank you for your question. Absolutely, it makes sense to me, and I would like to ask Director Nuntavong to please elaborate on that.
Thank you for your question, Senator. As I testified before the Senate committee a few months ago, dental care is health care. Our veterans deserve that health care. When I was on active duty, I saw the dentist twice a year regularly to receive my care, and that care needs to continue on as I am a veteran of the United States.
All right, so I look forward. We will introduce legislation and have in the past to make dental care part of VA healthcare, and we look forward to working with you on that. Let me touch on the broader issue that Senator Hirono and Senator Tester and others have raised. And I can recall, like it was yesterday, I think it was right in this room, when I was chair, we had a hearing, and we had all of the veterans organizations. We had the Legion there, we had the VFW, the DAV, and so forth. And I went down the list, and I asked them whether they thought VA healthcare was of high quality. And without exception, including the American Legion, the answer was yes, we are proud of what the VA does. Could it be better? We all agree it can. But one of the things we are also aware of, because the VA is a government program, that every time there is a problem in the VA, it makes the front pages of the newspapers. When there's a problem in a private hospital, somehow it doesn't make the front pages of the paper. Now, one of the concerns that I have is we have a national healthcare system with a lot of problems. We've got 30 million people uninsured. We have even more underinsured with high deductibles and copayments. We pay the highest prices in the world for prescription drugs. And in many ways, the VA has dealt with that issue. It has said, come on into the VA. We're going to give you holistic health care. And the door is open to you. And the cost of prescription drugs will be lower than in the private sector. It is no secret to you or to any American now, there's big differences of opinion here in Congress. There are people who do believe in privatization. And what I fear very much is if we continue to put all kinds of money into the private sector, you're going to be taking money out of the VA. And I worry very much that as we speak today, there are 46,000 vacancies in VA healthcare. And we can't expect VA to provide the quality care they should if there are those kinds of vacancies. Do you share the concern that some of us have raised about the fact that we are not adequately funding the VA in making sure that we fill those vacancies. Is that a concern, Commander, that you have?
Senator Sanders, I would like to ask Director Schuman to please respond to your question.
Thank you so very much, Senator. It is absolutely crucial that we fill the 46,000 vacancies at VA. As I've said, you have no greater friend in the American Legion than really working on reforms and legislation to make that happen.
Okay. And by the way, Matt, thank you very much for coming to Vermont for that very great town meeting we did. Mr. Chairman, my time has expired. Thank you very much. I yield.
The gentleman yields back. You want to do that? I'm informed that Dr. Rowe, or the ranking member of the House Committee, would like to, I'd like to recognize him for 5 minutes.
Well, it looks like the news story today is that Senator Sanders moved over to the Republican side. That was a...
Mr. Chairman, he's still to the left.
Not very likely.
But he's still seated to the left.
Glad to have you here, Senator. I will, first of all, Matt, thank you, and excuse Mr. Shulman. You have a great staff, Commander, and it is a pleasure to work with you guys. So thank you for that. I want to go through a few things very quickly. As the chairman just said, the bill we passed in the House last year did cover the Korean, the area in Korea that was sprayed by Agent Orange for the Blue Water Navy. I have some empathy with that because I stomped around that piece of ground for about a year of my life. I also want to congratulate the Legion on its 100th birthday. My old division, the 2nd Division, stood up 101 years ago, so it's basically the same age of the Legion. And also I want to thank the Legion. One of the pieces of legislation I'll carry with some pride from this is the Harry Comey Forever GI Bill. That is a great, I used the GI Bill in 1975 when I got out of the Army, and I'm grateful, Commander, to this day, the $300 a month that my country invested in me at that time to finish my education. And now that you can use it the rest of your life, technology is changing so rapidly that I thought that was, and we fully paid for that. I do want to mention just one thing to make, and Matt, you were very clear on that. Those 46,000 funded, they're funded positions. When I got here into Congress in 2009, we spent $97.5 billion on all VA care. That's health care, disability benefits, and cemeteries. And I also want to say one thing about cemeteries. Nobody in the world does it better than the VA. The VA cemeteries are phenomenal. I visited, I don't know how many, I have one a mile from my home in Johnson City, Tennessee. I'll tell you, if you ever go to sacred ground, it's a VA cemetery or a national cemetery. This government does. And we went last year, we took a group to Europe to see the World War II and World War I cemeteries. It was an extremely moving time for me to have visited those areas and see how sacred that ground is. We were spending 97.5. Our budget last year was north of $200 billion. So the VA has been funded, and everywhere I go, I ask them, do you have adequate resources to carry out your mission? And basically what they tell me at the VA medical centers and other places, they do have adequate funding to do that. Are there areas that need more funding? Sure. But I think right now that the VA, at least what I hear from the central office and from going down to various places that they have that. Suicide, to me, is one of the things I think that has bothered me the most since I've been a young person or even someone my age now that sees that as their only out in life. I mentioned when Commander Hastings, the Tennessee Guard, was here before. When he commanded, he's been replaced now, but they started a program called Guard Your Buddy. And he had 4 suicides in the first 40 days he was a commander of the Tennessee Guard. He said, I've got to do something. So they put this program in, and they've reduced suicide in the Tennessee Guard by almost 70%. And I ask, is this scalable? It is to our Guard and reservist members, and we should look at programs that work like that and don't reinvent the wheel, do that across the country. I think that's doable, and it's not very expensive. And I asked last year, we were spending $8 billion a year. Senator Bozeman talked about this, on mental health issues and suicide, and we hadn't moved the needle at all. So I said, well, why don't we do something different? And we had our hearing last September, and then a roundtable following that, and the chairman is going to continue this, I know, and work with us on trying to find out what works and let's quit doing the same thing. Let's do something different. Lastly, and basically I want to ask you guys on the Appeals Modernization Act. I guess our office is probably the most common thing we deal with are appeals that are backlogged. How do you guys see the new AMA program working? And we just went live last week for everybody, but how do you advise one of your members which lane to get into?
Well, thank you for your question, Congressman. I would ask our Chairman, Ralph Pizzella, of Veterans Affairs and Rehabilitation, to respond to your question, please.
Thank you.
Thank you, Commander. Thank you, Dr. Rowe. Of course, the American Legion worked with Congress, with VA, with the Board of Veterans' Appeals to design and develop that legislation. It was signed by the President on our stage at our National Convention in 2017, and we believe it will work. And the key to that is training our service officers how to do this in the best way, how to give that advice to that veteran making that choice of the higher review, the supplemental claim, or going directly to the Board of Veterans' Appeals. And that's where we're going to focus our efforts. There's not a simple answer for everybody. It's up to that veteran to make that choice based on the information that we can provide them.
Thank you. I yield back. Thank you, Mr. Wilson.
Thank you. Chairman Rowe yields, Ranking Member Rowe yields back. I'd like to now recognize the gentleman from Connecticut, former Marine veteran, Senator Blumenthal, for 5 minutes.
Thank you, Mr. Chairman, and thank you to you and the members of the House Committee for being here today. We appreciate your coming over to the Senate side, whether it's the left or the right part of the dais and podium. And thank you, Commander, for you and your team being here and your leadership day in and day out. I know from my experience in Connecticut as a proud member of the Legion that you were involved in so many community activities, and particularly the Boy State activities where three of my sons have participated, I believe. 2 of them now veterans themselves. And they better be members of the American Legion, as a matter of fact, if they know what's good for them. I want to thank Tom Flowers. I think he's here today, of the commander of the Connecticut Department. Thank you very much, and everyone from Connecticut who is here. This is a great day for you to be here when we are introducing legislation in honor of your being here. The Reach Every Veterans in Crisis Act, which I am helping to lead along with my colleagues, Senators Boozman, Sullivan, Hirono, and Brown. You heard Senator Hirono talk about it, because the VA has failed in reaching out to veterans who are at risk of suicide, spending only a tiny fraction of the money appropriated by the United States Congress for them to do their job. There has not been a lot of talk this morning about the Blue Water Navy Act. We came literally within a hair in the Senate. 1 or 2 members blocked unanimous consent from our proceeding with the House bill, thanks to the House, which was, I think, near unanimous in supporting it. Unfortunately, here in the Senate, we dropped the ball. And again, coming to the VA, I must say with all regret that Secretary Wilkie has been equivocal. Members of his team have been less than forthcoming in their support. I think that's an understatement. I'm here to ask for your continued support in passing the Blue Water Navy bill.
Thank you, Senator. We absolutely are in support of that. And let me take a moment of personal privilege. My Legion cover may say Virginia, but I entered the United States Army out of New Haven, Connecticut.
Thank you for your service, and thank you for that Connecticut connection. We're proud of it. Thank you. The Agent Orange Exposure Fairness Act. I'm a co-sponsor of the measure that Senator Moran mentioned earlier, because our battlefields are so rife with toxics and poisonous substances, whether it's the burn pits or the nerve gas that are found literally on today's battlefield in Iraq, Afghanistan, and Syria, where our men and women are exposed to those risks. The Agent Orange Exposure Fairness Act looks to the time that is necessary for diseases to manifest themselves. One of our fellow American Legion members, Jerry Wright, has championed this step. He was my guest at the State of the Union. We spoke to a lot of my colleagues about the need for the Agent Orange Exposure Fairness Act, not only for the Vietnam veterans, but also for veterans elsewhere in the world, the Korean DMZ, for example, where they have been similarly exposed to Agent Orange, which is a pesticide. It is a toxic chemical that has caused illnesses that we have not properly accounted for, and I hope for your support of that measure as well.
Senator, I believe we approved a resolution for that at our last national convention. Mr. Wright has been in continual contact with me about that, and I know he's been traveling around the country asking for support of that legislation and doing a dynamite job at it. So you have our support.
He has been tireless. As you know, he traveled across the country on his motorcycle with the insignia "Sprayed and Betrayed,"
yes,
which is a powerful way to put the betrayal of trust by the VA in those veterans who suffer from those diseases, as he does. And he is a real champion, and I know he's been in touch with you probably quite frequently. He is a great advocate, and again, I just want to finish by thanking all of your team. They do just a remarkable job here in the nation's capital and all around the country. Thank you so much.
Thank you.
Senator yields back. I want to now recognize the gentleman from Texas, new member of Congress, Mr. Allred, for 5 minutes.
Thank you, Mr. Chairman. And if there are any Texans who have hung in there, I'd love it if you could raise your hand or stand up. Just let me see you out there. Thank you so much to the Texans for your incredible service. I'm incredibly honored to be representing Dallas. Commander Rice said thank you so much for being here today, and to your incredible staff. I understand that I owe you a happy birthday coming up here.
Yes.
Nearly 100 years of incredible service to our nation's combat veterans and to really all of our veterans. And so on behalf of the 34,000 veterans in my district, and really all of the people who live in my district, I want to thank you and everybody at the Legion for all of your incredible service to our country.
Thank you.
I had the honor of being an appointee in the Obama administration of the Department of Housing and Urban Development before I sought this office. And we placed a large focus on combating and ending veterans' homelessness through the HUD and VA supportive housing program. And I was concerned to see in 2017 a rise in veterans' homelessness. Happy to see that there was a slight reversal of that in 2018. And I'd like to just ask you where we stand and how HUD and the VA are working together with you and with other VSOs to combat veterans' homelessness moving forward.
I would like to ask our legislative director, Matt Schuman, to elaborate, please.
Well, thank you for the question, Congressman. Making sure that there's not one homeless veteran on the street is absolutely the critical mission, one of the critical missions of the American Legion. The point in time in December, just a few months ago, had about 30,000 veterans at any given point were homeless, and as I think we've already said, that's just too many. The HUD-VASH program and the SSVF programs really need to be made permanent. We need the staff that run those programs don't need to be worrying about if they're going to have a job in 6 months. If they're worrying about themselves, how are they worrying about providing quality services and wraparound services to veterans? Further, it's not just about giving a homeless veteran a home. We can give them the biggest mansion in America. Unless we also provide those wraparound services from health care to job placement and mental health, they're going to end up back on the street. So we really need to take care of those veterans.
Thank you, Mr. Schuman. I completely agree with you. I think that your recommendation is right on. It's hard for us to plan long-term around a temporary program, and also homelessness often has so many factors that go into it, and providing a home is only one step in combating that. And so, thank you for that. We'll certainly be working towards that. Chairman Bozzella, I wanted to thank you for mentioning some of the creative therapies that are out there for veterans. We have a great organization in Dallas called eQuest that does great work with our veterans through equine therapy, which you mentioned specifically. And I am deeply concerned, as many of the members who have spoken here today are, about suicide prevention and what we can do to use creative methods to provide our veterans with the care that they need. And when I visited with the VA in Dallas, which is the second largest VA in the country, they expressed interest in having some help in working with some of the outside groups to kind of better form other forms of therapies and to use some of the resources that are at their disposal in a more efficient way. What can we do in Congress to help those organizations work with our VA to make sure that all of the resources that we have out there, and there are a number of great groups out there that are doing this kind of work, that they are actually at the fingertips of the VA?
Chairman Bozzella.
Thank you, Commander. Thank you, Congressman Elred. The number one thing that needs to happen is for VA to believe that alternative therapies are, in fact, viable, that they do work for people. One of the things that they do is they help veterans stay in the evidence-based therapies, the cognitive-based therapies, the prolonged exposure. Some of that therapy can be very difficult for people, and I'm sure Dr. Rowe would understand that, how tough it is to relive a traumatic experience. And sometimes they want to leave, where the CAM, we call it, complementary and alternative medicines, keeps them engaged. It does give them a sense of belonging and a sense of purpose. The equine stuff I think you're referring to, this almost magical what happens when veterans are teamed up with a horse and they have to care for that horse. That's a sense of purpose. That's a sense of belonging, having to care for another being. Yeah. And those kind of things work tremendously. So I think VA, and by the way, they are coming around to this stuff now. Yeah. And it's taken a while, but they're getting there. I'm glad to hear Dallas is interested. Mm-hmm. You can talk to the American Legions, the VFWs in your areas. You can get that kind of support from VSOs, and I'm sure they'll be there for you.
Yeah, we will do that. And my time has expired, but I just wanted to, again, thank all of you for being here. Thank you for your service to our country, and thank you so much for helping us understand the things that we need to be working on to make sure we keep our commitment to our veterans.
Gentleman yields back. I would now like to recognize myself for 5 minutes and just ask a few questions. Commander, the 2017 Government Accountability Office report found that VA faces significant challenges in recruiting and retaining employees. As was said earlier in the hearing, over 10% of full-time authorized and budgeted positions, funded positions, amounts to about 45,000 vacancies, and most of these being healthcare providers. Does the Legion have some specific recommendations about how VA can attract high-quality applicants and recommendations on how to reduce the long and cumbersome hiring and onboarding process at VA?
Absolutely we do, Mr. Chairman, and I would like to ask Chairman Bozzella to please address that question.
Thank you, Commander. Representative Chairman Tucano, that's one of the number one causes we see for the number of vacancies there are in VA healthcare is the onboarding process. Yeah, there's a gap with money certainly, but the process it takes 3 months or longer to recruit, to interview, to paperwork, to actually bringing that person on board is a very difficult process. I believe that Senator Cory Gardner from Colorado would like to introduce legislation that's calling for a pilot program in at least 10 VA sites to reduce the onboarding process. That would make a difference.
So it's not my it's not, you're verifying or validating some of the anecdotal stories I'm hearing about internists or specialists saying they haven't even received an acknowledgement they've applied to the VA. And that these are people that want to work for the VA and are highly employable, but the VA's lengthy process of hiring has, forced these individuals to just take other employment before they accept employment or even get interviewed at the VA.
If I may, Commander?
You may.
Mr. Chairman, you think about some of the really competitive healthcare environments in certain cities. The Bay Area, Shannon and I were there just a few weeks ago. New York City, Denver, places that are growing like that, and you have a competitive healthcare environment, and people are coming there applying for jobs. And if it takes 3 to 4 months to get hired with the VA for less money, or if they can get hired at a private hospital much sooner at more money, which way do you think they would go?
Yeah, well, one other question related to this. Senator Sanders and I, in the Choice Act, we were able to, along with other members and also the help of the my Republican colleagues, we inserted about 1,500 medical residencies into that bill, newly funded medical residencies across the country. Do you believe that the overall physician shortage is contributing to our difficulties in hiring and retaining?
Thank you, Commander. Mr. Chairman, yes, the overall physician shortages, especially in rural areas, absolutely does contribute to this particular problem.
Great. Well, I'm going to yield, cut my questioning short. I want to give now Ranking Member Rowe his opportunity to give his closing statement.
Thank you, Mr. Chairman. A couple of things on alternative therapy, Ms. Bozzella. I asked some wounded warriors, would they like to fish? And so the people that were doing that, they said, yeah, well, they're going to catch any fish. I said, I guarantee you, well, I got a fish hatchery in my district, so we've worked that out pretty well. They caught a lot of fish. And back to hiring, as the chairman is speaking of, he's absolutely right. Look, I can hire someone in my practice before VA can lick a stamp. They have got to get their act together on hiring people quicker, these qualified people, and especially on medical professionals, nurses, PAs, all of that. You're 100% correct on that. Thank you, and as we finish today, I want to thank all the Legionary members who've taken their time away from their families to come here today and be with us. I want to thank you for that. I would like to bring something to your attention, Commander, and the folks in the room, and ask for your help. And I know the VA, the Legion, is an ardent supporter of all constitutional rights. Yesterday, we in the House voted on a rule that will permit limited debate on legislation that would impact veterans' Second Amendment rights. This bill, H.R. 1112, will be considered in the House later today, this afternoon. A bill that unfortunately has had very little debate, minimal committee process. A little known and poorly understood provision of this bill would amend the law to read as follows. It shall be unlawful to sell any firearm or ammunition to any person knowing or having reasonable cause to believe such person has been adjudicated with mental illness, severe developmental disabilities, or severe emotional instability. To put this in perspective, there are over 1.6 million disabled veterans with a service-connected adjudication by VA of mental illness, including nearly 1 million with PTSD. H.R. 1112 has the potential to add all names of those veterans to the FBI's Nexus list and prevent those veterans from being able to purchase or possess a firearm. I offered an amendment to clarify that veterans with VA mental illnesses and other affected adjudications would be exempt from the bill's standard, but that was ruled out of order. Many people don't realize that the VA already regularly sends the names of veterans who have had a VA fiduciary for inclusion on the Nexus list, not because there's a concern that the veteran might be a harm to themselves or others, but because VA has determined that that veteran needs assistance in handling his or her financial benefits. I'm concerned that the expanded definition proposed in H.R. 1112 would infringe on the Second Amendment rights of millions of veterans solely because they sought the benefits from VA that they have rightly earned through their service to our country and now have been adjudicated with a service-connected mental illness. But like those veterans with fiduciaries, even though there may not have ever been a finding by judicial authority, a judge, that the veteran possesses a danger to themselves or society, these veterans would be told that they were good enough to use a firearm to fight for our freedoms, but not good enough to bear arms as a civilian. The last thing I want to do is discourage veterans from seeking VA benefits because they're afraid it might cost a constitutional right if they receive a rating decision for a service-connected mental illness. And look, we need your help with this just to slow this down and debate it. And everyone up here wants people who are mentally unstable not to have a firearm. There's not a person in this room doesn't want that. But we don't want veterans who've protected the rights of the Constitution to give up those rights. Please, I ask for your help, and just to slow this down. I don't think it was intended. I don't think that was an intention with this bill, but that certainly is going to be what happens. Again, Mr. Chairman, thank you. It's a privilege to serve with you on the committee, and I look forward to working in this Congress to carry out all the things we talked about and hopefully more. And with that, I yield back my time.
I thank the gentleman. I just want to address briefly the concerns raised by my friend and colleague Phil Rowe about the bill that he mentioned. That bill will not come up for a vote today. It will come up for a vote tomorrow, scheduled for tomorrow. I want to say that the concern arises out of actually language that was meant to replace a more offensive current language, language in the current law, which refers to people who are mentally defective. That is obviously outdated, offensive language. And the Judiciary Committee struggled to find language that would replace the current language of mentally defective. That is wrong. That is terrible language, and that's actually in the current law. The language that is currently in the bill is meant to be placeholder language. They're trying to find the right terms so that what Dr. Rowe talked about, and he actually he used the words potentially. And we're talking here about getting the language right so that it cannot be interpreted in such a way that veterans who have financial difficulties are not put on the next list. We want to avoid that from happening. We do, people on my side of the aisle are interested and committed to protecting the Second Amendment rights, especially of our nation's veterans. And so the Chairman Nadler, my understanding is that he is writing a letter assuring that any final language of the bill before it is sent over to the Senate is corrected, and he is committed to working with the veteran service organizations and getting this language correct. So stay tuned. We will be in communication. I have been, as soon as I heard Dr. Rowe bring this concern to yesterday's joint hearing, I immediately went into work as the chairman of the Veterans Affairs Committee in the House to work with the Democratic leadership to problem solve this particular issue. But let me just say that I always enjoy these joint hearings and hearing the priorities of the American Legion. Will be meeting with the Secretary of the Veterans Affairs Department today, Secretary Wilkie. I will be pressing him on the question of will he be appealing the Blue Water Navy decision, and I will be encouraging him to desist from doing that. And regardless of his answers, we are going to move forward with the Blue Water Navy bill as I've introduced it in this session of Congress, and we're going to pass that bill, and we are going to press the Senate to get it done, and we are going to get this issue off the table in the 116th Congress. And I want to acknowledge that Dr. Rowe had taken this over the finish line in the House, to clarify, there was some doubt about whether the vote was unanimous. It was unanimous. Thank you, Phil Rowe, for that unanimous vote in the last Congress, and we're going to get it done. We're going to get it done in the Senate, and what I need your help with is to make sure that no senator stands in the way of the Blue Water Navy bill solution. So thank you. Let me also say that I do appreciate the Legion's stance on the 30-minute access standard. I do think it still raises questions. It is potentially a good thing, also potentially something that could result in a diversion of precious healthcare dollars away from the existing internal capacity of the VA to serve veterans. It's potential. It's all a matter of how this administration rolls out and implements the Mission Act. And of course, we'll be working very closely with the VA, with the American Legion, to make sure that the rollout of the Mission Act and its implementation is done in such a way that we build capacity, internal capacity, and we are flexible enough to reach the veterans where they are and to make sure they get health care that's second to none. We will also be doing our level best to make sure that the Forever GI Bill is implemented, and I certainly do appreciate the American Legion's stance on closing the 90-10 loophole. That will do much to protect our student veterans and to ensure that they are on their way to success in our economy and the job market. And with that,
Mr. Chairman, may I be recognized for just 1 minute?
I'll yield for a minute.
Thank you. Just to clarify a few points on this 1112, I'm not trying to engage in fear-mongering, but I am concerned where H.R. 1112 may take us. It's my belief that the Judiciary Committee did not mean to have this negative impact on veterans. However, I do think that the process of 1112 has been rushed, and that is an unintended consequence. Additionally, we cannot ignore the very real implications for our veterans, even if that's not the intent of the bill. It can happen. I'm also not saying that a simple diagnosis of a mental health condition alone would amount to a veteran's name being sent to the Nexus list. On that, I think that the Nexus Improvement Act of 2007 is fairly clear. But right now, VA adjudications that certain veterans require a fiduciary to handle their financial benefits are deemed to meet adjudication as a mental defect requirement under Title 18, and those veterans are placed on the Nexus list. The process itself would not change as a result of H.R. 12, only the definition. Under current law, the quotes mental defective definition is already binding on VA, and based on current law, VA regularly sends veterans' names to the FBI. And again, under H.R. 1112, nothing about that process would change, but the definition of who should be added to the Nexus list would be significantly expanded. That's why I think it is a very real possibility that VA ratings decisions that award service connection for PTSD or other mental illnesses, just like current VA adjudications, that a veteran requires a fiduciary would cause our nation's brave men and women who serve to lose their constitutional rights to bear arms. And to be clear, I'm not saying that no veteran should not be placed on this Nexus list. We all know that's true. But I do believe that we must tread very carefully and ensure that proper due process is given and that a judicial authority, not a VA rater or bureaucrat, should be the one who decides whether or not a veteran is a harm to themselves or others before we look at infringing on their constitutional rights. It's a slippery slope we're on. Chairman Takano, I appreciate your indulgence. You've been very good about this, and I yield back my time.
Well, I do believe in a robust and thorough and complete discussion of the issues of the day, including, and especially including fundamental issues of our constitutional rights and of the Second Amendment. But let me just say that 90% of Americans, including overwhelming majorities of those who belong to the National Rifle Association, believe that background checks are reasonable. In order to make those background checks effective, we need to have the nexus lists also complete. And that being said, we are working, I think working with VSOs like the American Legion, we can, the chairman and the parties can get this language correct. We're talking about trying to replace outmoded offensive language that already exists in law, and to find that sweet spot in a law that makes the NICS list complete, but also does not unfairly and unjustly put our nation's veterans on those lists. So with that, I'd like to call to adjourn these proceedings, and thank you, the American Legion, for another great year of testimony.
Thank you, Mr. Chairman.